Welcome, doctors and healthcare providers. Today, we're diving into an incredibly important topic, HIPAA compliance in medical revenue cycle management. It's a crucial area for protecting patient information and ensuring the financial health of your practice. So, let's get into it. When we talk about medical revenue cycle management, or RCM, we're referring to the entire process of tracking a patient's care, starting from the moment they make an appointment. This includes insurance verification, coding, billing, claim submission, payment posting, and even handling denials. Now, as you can imagine, during all these stages, a lot of sensitive patient data, also known as protected health information, or PHI, is handled. HIPAA, the Health Insurance Portability and Accountability Act, sets strict standards for safeguarding this information. The goal? To make sure that unauthorized people don't access or misuse this private data. Here's why HIPAA compliance is so critical for you as healthcare providers. Non-compliance can lead to serious consequences, including hefty fines, legal action, and a loss of trust from your patients. So, ensuring that your revenue cycle process is HIPAA compliant isn't just a legal requirement. Let's break down some of the key HIPAA requirements that directly impact revenue cycle management. First, we have the privacy rule. It says that PHI should only be used or disclosed for authorized purposes, sharing information with your billing vendors or insurance companies. Then, there's the security rule. This one focuses on protecting electronic PHI, or e-PHI, for your practice. This means implementing safeguards like encryption, firewalls, and access controls to protect patient data from unauthorized access. Another essential point is patient rights. Patients have the right to access and request corrections to their billing information. As part of your RCM team, you need to ensure that your processes allow for these requests to be handled smoothly and in line with HIPAA guidelines. If you're working with third-party vendors for billing or software services, you'll need to have business associate agreements, BAS, in place with them. These agreements ensure that your vendors are also HIPAA compliant. And lastly, training and awareness for your staff is key. Everyone involved in your revenue cycle needs to be regularly trained policies and procedures so there's less chance of an accidental breach or unauthorized disclosure. But maintaining HIPAA compliance in RCM isn't without its challenges. There's the huge volume and complexity of data flowing through various systems and the constant need to stay updated with new technologies and regulations. Plus, human error, like accidentally sharing PHI, can still happen. So, what can you do to ensure you're staying compliant? A few best practices include conducting regular risk assessments to identify vulnerabilities in your systems and processes, implementing role-based access controls so only the right people have access to PHI using secure communication channels, like encryption, for sending patient data, monitoring and auditing access logs to spot any suspicious activity, keeping comprehensive documentation of your compliance efforts, staff training, and incident responses. Finally, it's important to continuously update your policies to keep up with the evolving landscape of regulations and technology. So, what did we learn? HIPAA compliance is not just about following the law, it's about creating a culture of trust and security for your patients. When you integrate HIPAA principles into every aspect of your revenue cycle, you not only avoid penalties but also build stronger relationships with your patients. Thank you for tuning in.